Well, welcome everybody who's on Facebook and kind of checking us out right now. Thank you for my speakers who are here with us today at our first drug use and coronavirus live Q&A. I'm your host, Tony Martinez, PRC CCP program director at Oliviani. And so really the purpose of this event is really to get resources out to the community. We want to help and support individuals and families during this difficult situation, and really talk about how substance use can potentially impact you and your loved ones. But before we kind of begin, I do want to take a moment in recognition of those whose lives have been lost from COVID-19. Thank you all for that moment of silence in recognition of those who have passed, both worldwide and also locally. We know that we've had, up until recently, 33 community deaths in our region. And so, we want to help support those who've kind of lost loved ones during this time. Just as a form of meeting logistics, and to know how you can participate. If you have any comments and or questions, we want you to go to our Facebook Live video posting. And so where you'll find that is on our facebook.com /PRC Region 10 page. So you go to that page and you'll see live, right now, this video. And so if you have any questions, our team is available to refer those questions over to us on the Zoom call. So I have my colleague, David, our tobacco coordinator, who will help facilitate those questions for us. And so right now I'm going to take the opportunity to introduce my speakers with me today. And then also, as I'm introducing them, if you wouldn't mind, each of you kind of sharing, a little bit about kind of your role in the community and how substance use has as how you see it within your organization. So my first speaker is Annette Torres, who is program manager at YMCA. And so we're very thankful that you're here with us today. Annette, welcome.
Thank you, Tony. It is an honor to be here, to be talking to everybody today. My role at the YMCA is as program manager for the Smoke-Free Initiative of the Paso Norte Health Foundation. So we have been involved in the field of tobacco prevention and control for a little over 20 years now, and have been very fortunate to work in the policy field, really, with helping to establish and to promote smoke-free policies within our community, whether that's in regards to businesses, if that's education. We're very proud that El Paso Community College just passed a comprehensive smoke-free, tobacco-free policy that will be instituted this fall for those students who do come back to campus if campus opens in the fall. And we are working with partners in the community to look to expand tobacco-free policies in multiple areas. So really, this is a great opportunity for us as well to let people know what's going on in the community in that way and invite them to join us in whatever capacity that they are able. So thank you so much for having us on.
Wonderful. Thank you so much, Annette, for that brief intro. Also with us on the call today, Elizabeth Zarate, OSAR Supported Employment Supervisor at Emergence Health Network. Liz, how are you this morning?
Good morning. Thank you. Thank you for having us. I'm doing very well. Thank you, everybody, for joining us. Of course, I am Elizabeth Zarate, and I do work with Emergence Health Network. I am the program supervisor for two programs, one being the OSAR and the second one being supported employment. So basically what OSAR does is we are outreach, screening, assessment, and referral. And what we do is that we provide screening and or assessments to any Texas residents in Region 10, ages 13 and over. So what we do is we have licensed counselors on the team providing those screenings and assessments and referring to the community appropriately. Based on individual needs. The supported employment, of course, we have two job developers on site that serve any individual that's 18 years of age and older with a history of opiate use find competitive employment. And so, again, thank you for having us, and we're really glad that everybody's joining us.
Also, thank you so much, Liz, for that intro in terms of the work that you're doing at OSAR and the supported employment. We also have on the call with us today Carlos Pacheco, Marketing Liaison at El Paso Behavioral Health System. Welcome, Carlos. Why don't you tell us a little bit about kind of your role within your organization and kind of how you all are handling the substance use during this time?
Hi, good morning. Sorry for the delay. Well, my role for the organization is just to educate the community on what it is we offer there at our hospital. Now, right now, during this time and as far as substance abuse goes, we're still able to treat people on an inpatient and outpatient basis. We offer our rehab, chemical dependency, detox there at our facility. We do offer, obviously, substance abuse on an outpatient basis, so people can just go into our outpatient clinic as well. So that's what we're doing right now. Of course, we're following all the CDC recommendations and trying to keep everybody as safe as possible.
Wonderful. Thank you so much, Carlos, for joining the conversation today. I do want to just kind of put out a quick disclaimer for those who are watching this video. The information that we're going to be sharing, all of our speakers, is for informational purposes only. It's not meant to replace any medical advice or any physician advice that you've already received. So that's very important that we kind of put that out there. I do just kind of as a way to start this conversation off, a bit of context. So we know that substance use impacts individuals differently. It can develop in its, I guess, most severe form into an addiction where we know that there's brain changes. We know that, for some, it's that there's a genetic influence. And so you have addiction, right? So that's on the one hand, you have addiction. And then on the other, you're integrating now this virus that's really just kind of impacting us worldwide. And even at the local level, integrating things like social distancing and making sure that we're kind of keeping people safe and wearing face masks and testing and all of this. So we're really in a new environment, right, for all of us, right? And so I'm curious, what are your thoughts on how coronavirus will impact either schools or drug testing or street level drugs? I mean, let's kind of start us off in the conversation. Annette, what do you think?
So I think right now what we're seeing, mostly anecdotally, is that there is not a significant difference in how people are accessing tobacco and nicotine products, whether it is for those over the age of 21, or unfortunately, even with the federal law raising the age to purchase tobacco products to 21. We know that youth under the age of 21, under the age of 18, are still being able to access tobacco products. So they may not be on a school campus, but they're still able to interact with those who are providing them tobacco products. And though COVID-19 did impact our economy and shutter, or at least take businesses offline for a certain period of time, and tobacco products were not, or the sale, vape shops, tobacco shops weren't always considered essential businesses. We know that convenience stores, grocery stores, those places do sell vaping devices, of course, regular cigarettes. So everyone's able to access those products. So we have not seen, I don't think, a significant decline in access. What we will see in a few weeks is whether or not individuals took this opportunity to quit. So hopefully in a few weeks, when we look at numbers statewide, we'll be able to see if individuals were at least questioning whether now is a good time to take that step. whether they were reaching out to help and say, can I talk to somebody? And so it will look different in a month. We know that, but right now we just don't know what the full picture is.
Yeah, well, I mean, I definitely think that there is at least some comfort in terms of prevention, that you know folks are getting limited access in terms of like not having folks in school get these products. But as you're pointing out, people are still getting them through other means, right? Through other mechanisms. Liz, what are you seeing on your end in terms of how this virus is impacting our community?
I think I agree a little bit with Annette, is that we won't be able to see the full picture until maybe a month later or even a little bit further out. But some of the things that we see here now is that we are seeing an increase in, we are actually seeing an increase in people reaching out. And these being referrals that are self referred, individuals that are actually reaching out to get the assistance. It's not a big number right now, but it's compared to other months that we've had specifically speaking for Ozark, the numbers have increased of individuals that we are seeing seeking out services, and this includes nicotine. So yes, most definitely, I'm seeing that, and I also foresee a lot of like Annette said, that are still going to be out there. What I foresee happening is that an increase in more of what's at home, because people are still at home, people are still overwhelmed with the uncertainty of what's happening around us, and when are we really going to open, are we going to end up closing again, what's happening is still up in the air, so to speak. So what's happening is that, access to alcohol, access to nicotine, access to prescription medication is in the home might also increase.
Yeah, definitely. I think that there's a potential for that increase, but as you're kind of highlighting, Liz, and it's right. I mean, we can't tell like how specifically it's impacting us right now. But what we're kind of sharing is really just what we're seeing, right? From where we're at, how things are changing. Carlos, I mean, what are you guys seeing on your end? Are there any changes as it relates to this situation?
Tony, unfortunately not. There hasn't really been a lot of changes. I agree with Annette and Liz. We're still seeing people coming in with mental health crisis and specifically substance abuse. I don't know, maybe it's a downtime or, as Annette and Liz have been saying, the access to substances that really hasn't changed all that much as far as people coming in for assessments there at our hospital. So unfortunately, it still pretty much remains the same.
Yeah, no, and I mean, I think that's relatively probably the norm. I remember coming across this disaster preparedness article talking about how in the midst of a disaster, what they see in previous disasters is that in the grand scheme of things, substance use doesn't really change a whole lot. Like it kind of goes up and down, but generally they see kind of a regular pattern. So that might be at play here. But as we're I want to remind our audience that if you guys have any questions, if you have any comments for our experts on the call today, please feel free to write them in our Facebook feed. There's a team there kind of readily available to refer those questions over to us. And so as we're waiting, I know that one of the things that is really important for folks to be aware of is how people gain access to services. So Liz, you were kind of highlighting how you were seeing some increase in kind of self-referrals. So why don't you kind of share with us what that process looks like for people wanting substance use services?
So the process is actually very simple. If an individual is seeking services or somebody that you might know, somebody you care about, you really just need to call our number, which is, I believe we're going to add it on here. Correct, Antonio? I'm sorry. It's going to be to reach out. And so if somebody's looking for services, you just call our Ozark number, which is 915-747-3605. what they'll do is that they'll schedule a telehealth appointment with one of our licensed counselors to provide you that screening. So you'll have access to be able to sign over those consent forms and all the intake information that we need via a patient portal. So the individual will have access to that patient portal, be able to sign all those forms, see a licensed counselor to do the screening, and at that time they'll also be able to assess what the individual needs are for that person and provide those referrals as appropriate. And so for supported employment, it's the same process. It's being able to get access to an intake appointment and to be seen via telehealth services to get you started with that program as well.
Yeah, and if I understand kind of the process, when you guys screen them, you really screen them for any need that they might have, right? So like, let's say if they needed like treatment, you would probably refer them to folks like, Carlos at El Paso Behavioral Health and other providers.
Absolutely. So our primary focus is substance use. However, if we identify a need, that could be mental health, it could be a food pantry, it could be employment, we do refer appropriately. So we do refer in, our services are at no cost. So what we do is that we do a financial to determine your financial, whether you have insurance or not, and then we refer whether it's in-house or out-house, and definitely to programs like Mr. Pacheco, to Annette's programs, to any other program out in the community. So yes, we do. And so also programs like, for example, substance use, if you need detox, if you need inpatient, if you need intensive outpatient, outpatient, any services, recovery support services.
Yeah, and I really think, I look at OSAR and it's like, for many folks, it's a great starting point, right? Like if you don't know where to go to OSAR. They'll kind of help you and guide you to where you need to go in terms of services. I am seeing that we did get a question, and I don't know, who would like to kind of tackle this question on the call, but the question comes from Carlos Falk, and he says, "Why are liquor store workers considered essential?" I mean, that's a good question, right? And not too long ago, we had we were referencing through our Facebook page that alcohol sales were going up, right, during this time. And so I don't know who has any thoughts in terms of this question. Why are liquor store workers essential?
You could go many ways to answer that question. You have some very very strong groups in the state that do promote their business and do talk about the weight that it brings to the economy and thus to the state. And there are some legitimate arguments there, but I think when it comes down to it, when you look at it from the perspective of prevention and the field of substance use, we know that alcohol and the use of alcohol in our community is very much the norm. It is an acceptable drug that most people use responsibly. And so when you look at it from the perspective of people being able to access something that they do use responsibly, that they do have legal ability to get, that is something that the state as a whole provided them the opportunity to do for many reasons, many economic benefits. So it is a legal drug. It is a substance that, again, most people use responsibly. And so if they can have and continue to access this and promote the way of life for many people, I think the governor looked at that from a certain perspective and was able to push that through. My opinion.
Yeah, thank you so much, Annette. I really, really appreciate the thought. Liz, Carlos, you guys want to chime in? Or you like that answer?
Well said, Ms. Carlos. That was a very good question, Ms. Carlos. I'm with Annette on that. There's so many ways you could go. There's so many arguments. So I'm with Annette on that answer.
Carlos, anything to add?
No, not really. I mean, I think Annette pretty much covered everything. You know, it is a drug that's acceptable, and access is always going to be there. And as long as, you know, grocery stores and convenience stores are going to be open, you know, liquor stores are going to try and find a way to add themselves onto that list.
Yeah. Well, thank you all for your responses, and also Carlos for your question. So as we're waiting for some more questions from our audience, it can be, as some of you might imagine, it can be scary for folks to kind of access services, right? Maybe folks are not ready, or you know they don't know what to expect, and so you know, hypothetically speaking, you have an individual who's been referred from Ozar, and now you know they're at El Paso Behavioral Health. Carlos, I mean, what can they expect in terms of, you know, next steps?
Well, I mean, they can expect to have, if they come in and they're there at our hospital already for substance abuse, they can expect to have, you know, a doctor, a nurse, as well as a therapist, all looking after their best needs. It's going to be if needed, it's going to be a medically supervised detox, as well as, you know, a psych eval, and trying to step them down from, you know, a mental health and substance abuse crisis a little bit down, so they can go to programs like OSAR and they can be out in the community and not be a danger to themselves or somebody else.
Yeah, thank you, Carlos. And so I mean, it sounds like it's a team approach, right? It's several, you know, professionals who are kind of making sure that this individual is taken care of. I like that. I love that that whole team, holistic approach to medicine and healthcare. Um, we don't have any current questions yet. Again, if you have, actually, we just got a comment. So I'm going to read the comment. You guys let me know if you have any thoughts in terms of it. So Valerie says she's a coordinator from the Collegiate Recovery Program at UTEP. And she's curious about whether any of you have been seeing or hearing concern from the people you work with regarding the particularly dangerous connection between COVID-19 and lung health, as affected by nicotine or other drug use. Also, hi, Tony and Liz. Hi, Valerie, thank you so much. Appreciate it. Thank you for your comment and question. So what are your thoughts in terms of, you know, this dangerous connection between COVID-19 and lung health? Annette, why don't we start with you?
We have seen a lot of questions back and forth in the literature from very early on. And so we are still in the midst of this pandemic. It's really just getting started. So we don't have a lot of information, concrete facts about the effects of the coronavirus, COVID-19, on the lungs. We know that it is still primarily a respiratory infection, and we know that smoking, and in some ways it's indicative of vaping as well, can adversely affect the lungs. We know smoking does that. So we are reading a lot about how smokers are affected adversely. They are more susceptible to the disease, as well as more vulnerable to the symptoms of the coronavirus. That's fairly well established in the literature. So we know that we have heard and seen that the University of California, San Francisco has included in their screening of COVID-19 patients, asking them about whether or not they are smoking. It is one of the few resources that we've seen where people are doing that and taking that step to be able to catalog smokers and non-smokers, severity of disease, and so forth, really in a year to publish information. So right now, what most doctors are recommending is, if you are a smoker, if you are concerned, the best steps that you can take are to really look at resources available to you to quit. Reaching out, having that initial conversation. Locally, if it's individuals who are interested, we have the 915-534-QUIT hotline, which is, of course, 915-534-7848. They can reach out, they can talk to someone about their concerns, and if they're ready, take that step and get help to quit. So if individuals want information, that is definitely a resource available for them.
Yeah, thank you so much, Annette and Valerie, for that question. You'll see in your feed that resource information that Annette just shared. If you didn't catch that as she was talking about it, we also have another question, and I think Liz, I'm going to have you take a stab at this question from Lydia Carrillo. So she's asking, what do we know about people who misuse drugs? Right, so individuals who are using, and if that makes them more or less susceptible to COVID-19. I mean, what are your thoughts on that?
Again, I'm with Annette, is that I am not a medical doctor, but from what we know of substances, we already know specifically with COVID-19 seems to be concentrated among those individuals that have an underlying health issue. With substance use, if you, let's say, for example, specifically opiate use, right? So prescription pills, street heroin, they're already very, how can I say this? Opiates act in the brainstem to slow your breathing. So what's happening is that it kind of actually puts the individual at greater risk for an overdose. So when you're talking about how it affects them, their lungs, their breathing, if you're using opiates, if you're using other drugs, like a history of methamphetamine, people that are injection drug users, specifically anybody who is vaping, anybody who is smoking, is going to have those effects on them too. So it is, they're at higher risk to be more susceptible to COVID-19.
Yeah, no, definitely. So you heard it here, you folks. There's obviously this connection between opioid misuse. We talked about the influence on tobacco and how that impacts COVID-19. Lydia, thank you so much for your question. Carlos, I'm going to have you kind of tackle this next question from Saida Flores. So she's asking, what strategies or coping skills do you recommend for individuals with addiction issues or substance use issues, right, to use to cope during this pandemic and the stress involved and the anxiety? I mean, what are your thoughts on that, Carlos?
Well, I think if somebody's abusing or using substances, especially right now with social distancing and having to stay home, I think it's important to reach out to all the different resources that this community provides. You know, as we're all talking, it sounds like we're all kind of on the same page as far as what's going on in the community, and I think that's a great thing. So we're all there to help people that are going through some sort of crisis or putting themselves at danger by using, all the substances that are available right now, So I think that's the most important thing, reach out to friends, reach out to, somebody that might know anybody that might guide them to the right services. I think, we've all worked together. All of our organizations have worked together to just kind of guide somebody if it's not, El Paso Behavioral Health, it's Ozar or the people at Emergence, all our MAD, everybody, all our community partners out there. So Aliviane, of course. So I think that's the most important thing, is just to reach out and ask for help. The help is there, and like I said, if it's not for Emergence, if it's not for, us at El Paso Behavioral, maybe it's for Aliviane, maybe, and since we all work so close together, I think we can all continue that and reach out and help people that might need it.
Absolutely. Get help, get connected. I mean, that's kind of what Carlos is talking about. And as Carlos was kind of sharing that input on this question, I was reminded of a resource. If you're not familiar with it, it's the National Suicide Hotline. You know, this is a real thing. People do experience, suicide ideation during this time. And so if you have any questions, there's a 1-800 number, and we'll put it in the Facebook feed, 1-800-273-8255. Again, 1-800-273-8255. So that's just kind of one resource, right, of a whole host of different resources available. And I know Emergence also has their crisis line. Liz, tell us about that.
Absolutely. If you need to reach out now, if you can't wait, if it's now a situation where it's a crisis and you really do need to reach out to somebody right now and not really wait, we do have our crisis. Emergence Health Network has our crisis line. That number is 915-779-1800. And it's kind of like, to touch on what Carlos says, is a lot of times it's not knowing that the community is, we have a lot of resources, and it's just tapping into those resources, knowing where to go. And I think us 4 individuals that are on this call right now are part of a community that really does work well together. And we, it's our job to know what's out there for the people that we serve. So it's definitely, letting you know we are here for you. Just call any one of us. We will guide you in the right direction, whether it's our program or anybody else's program. We're here, and that's what counts. It's just making sure that they take that first step in reaching out.
Thank you so much, Saida, for that question. Very timely question during this situation. And as our speakers were highlighting, I mean, it's something that, and I know it's not unique to El Paso, but it's definitely something that we have that I think is very special in one way, is that we're also interconnected. Right? There's this sense within our community that says, hey, if I'm not the person to provide you with the right resources, I can get you connected with the right resources, right? I know, we talk enough during community meetings and other situations where we're so involved in each other's organizations that our main goal as a community is just to help, individuals who need help, right? And so I love that message. We also have another question from Susie. Hello, Susie. How are you doing? Susie Villalobos is asking, are there additional challenges for a person with a substance use order during this time? That's a very good question. I'm going to start with Carlos, and then we'll kind of work our way through Liz and Annette to see what your thoughts are on this.
Well, I mean, it goes in with having to reach out again and taking precautions, to get the help that's necessary. So somebody comes in, obviously, and they're positive for COVID, it's going to be a little bit challenging in order to go out and get the help that they need, because they do have to self-quarantine and they do have to take care of themselves physically before they can come in and get any type of help. We're taking precautions there at the hospital. We haven't had any cases there at our hospital, but that's not to say that somebody can come in because they came in contact with somebody a long time ago and they got infected. So I think it is difficult. But I mean, there's always a way. Telehealth, as on an outpatient basis, something that they can still get some kind of counseling, some kind of help while they're at home.
Absolutely. As Carlos was highlighting, there's telehealth and other services. Liz, what additional challenges are people experiencing?
I think that's the big one right there that Carlos just mentioned, is access to the service. Now, due to the pandemic and social distancing, we're not able to it's not as easy for an individual to say, I'm just going to walk into an OZAR office and ask for a screening, because now we can't do that. So we've had to modify our services, and I'm sure we're not the only ones. The entire community has had to modify their services to be able to provide it in a way that's now safe for everyone. So one of the things that we're doing now, of course, is telehealth. And that could be one of the challenges for our individuals, because not everybody is tech savvy. Hi, that's me. And not everybody has access to that technology at times. So that can be that could pose as a challenge for individuals that are trying to seek help. Even though that those services are really great and we've gotten a lot of positive feedback about the services that EHN is providing via telehealth, it still poses sometimes as a barrier or something that's new, something that, not everybody's very good with change and having to adapt with the changes that are happening, with all this pandemic. So that's one of the big ones that I know that is a challenge.
Yeah, thank you, Liz. And before jumping into Annette, I do want to mention that, almost all of the providers that I'm aware of have kind of transitioned over to using telehealth services. And even before kind of even having that first interaction with folks, I know some of our team members who are offering these services have a test call with folks. And they're like, hey, let me just test out the system. I'll do a test call with you just to kind of ease folks into that process, because it's different for a lot of folks, right? And so that's something to keep in mind. Annette, what are your thoughts on kind of the additional challenges?
It's actually twofold when I look at tobacco. You have light and intermittent smokers or social smokers who would only use substances when they were in particular circumstances, if they're out at the bar, if they're gathering with friends. And those individuals don't necessarily have those triggers right now as we're sheltering at home and isolating ourselves. So you may see those individuals not reaching for a nicotine product quite as often because they're not in those situations. So those triggers aren't necessarily affecting them. So they'll find themselves maybe using the product less. But then you look at those individuals who maybe, say, quit 5 years ago, 7 years ago, who are now facing job loss, who are finding themselves without health insurance or food to provide money to provide food for their families. And that stress can lead them to want to go back to nicotine as that crutch. And so you may see people looking and searching out for that substance more. And I think that's why it's so important to point out that the resources that the state offers, that the Quit Line offers, are free. This is an opportunity that if you find yourself in this situation and your stress level is going up, you can log on to smokefreepdn.org. You can get in touch with them. You can call 915-534-7848, and you can talk to someone free of charge. They can text you if if you'd rather have it that way. They can call you back, and they can give you nicotine replacement therapy. So those are opportunities that if you do find yourself in a situation where you're feeling stress and think that turning back to nicotine might be the answer, taking the step to call first and reaching out to someone to talk it through might be the better option.
Yeah, no, thank you so much, Annette, for that kind of multi-perspective on tobacco. But one of the things that I heard, and I want to jump to Liz in terms of this question. One of the things that I heard, that because of the triggering that could potentially happen, folks can kind of struggle through relapse, right? Let's say, so they've been in recovery for some time, and now in this isolation, period, folks can struggle with that. Liz, I mean, what do we tell folks, during this isolation period, and if they are struggling from relapse?
I think it goes back to what Carlos said: is reach out to somebody. It doesn't always have to be necessarily an agency like us, which that's what we want, because we do have the professionals here to help you and assist you. But at the time, if for whatever reason a lot of people don't feel comfortable reaching out, maybe the first step is to reach out to somebody somebody close to you, for that assistance. And that person, whoever that may be, and one of the things that I like to tell family members that come to us at times, they say, well, I have a cousin who is going through this, or a family member or a friend. And we encourage those individuals that know to reach out to us and to let us try to talk to that individual if possible. It really is about reaching out. And if you can't, and if for whatever reason you don't want to, it's a simple, it's not simple. It's not a simple answer, right? Because they're going through a lot, is to try to, and most of the people who are currently in recovery and in danger of relapsing have been through some kind of a program where they've been taught some of those coping skills. And so it's really looking back into those, referring back to some of those coping skills and applying them to yourself. And if not, definitely reaching out to the virtual groups that are available. We still continue to have AA that are to virtual. We still continue to have NA, all the other programs available to people to reach out for that assistance. But it is really, you're right, you know, there's a potential for that relapse.
So I do want to thank you so much, Liz, for kind of echoing that message of reaching out. It's so important, whether that's, you know, a direct message on a social media platform, a text, a phone call, you know, virtual, whatever. Reach out. I'm going to read this comment I really liked from Saida, who talks about how we have to educate. I guess she's referring to providers, people that are not ready to stop using substances, because sometimes there are people that are not ready, about the risk of kind of sharing equipment and the risk of getting COVID-19 during the situation. I think that's definitely all our responsibility. I think that's a great point. Thank you so much, Saida, for that. And I do want to jump to Carlos with this next question. I mean, what are you all suggesting? And then we'll kind of go to the other folks if you guys have any additional comments. But what do you suggest to people who aren't looking for help virtually? Like, let's say you have, you know, somebody who's not comfortable with that technology. What do you advise, Carlos?
Well, I mean, you could get it over the phone, you know, like Liz and I, who aren't very, very tech savvy, me showing up a couple of minutes late because I couldn't log in. You can always do it for the phone. You do it telehealth. We do it in person there at our hospital. You know, we're still taking patients on a walk-in basis. You can call and make an appointment. So, you know, if you want to take extra precautions, you know, just because you don't want to use telehealth doesn't mean that people aren't willing to help. So if you don't want the telehealth, you know, you can use the phone, you can show up, social distancing. There's still ways, you know, to get help that you need, you know, especially with something as dangerous as substance abuse, you know, where there's a will, there's a way. And even if there's something holding you back, you know, you can always try. Everybody can work together to keep everybody safe and still get the help that they need. You know, our hospital will do our free assessments on the phone, in person, telehealth. But there are some people that we've seen that don't want to do telehealth, that don't want to. So, you know, our outpatient groups, for example, we have the technology to do telehealth, so they can stay home and do it, get their outpatient care that way. But if not, they can always come in. They can always come in. We're practicing social distancing. We're constantly disinfecting, you know, more than before to try and keep everybody safe. So, like I said, where there's a will, there's a way. And like Liz said, it's all about reaching out. It's all about reaching out and just getting out there and making the effort to keep themselves safe and keep everybody else safe as well.
Thank you, Carlos. And I know Emergence is also a big provider of services. I mean, what are your thoughts in terms of this? You know, folks who don't want to do things virtually, Liz.
I think at this time, it's with what Carlos said, that we do provide services via telehealth. It doesn't always have to be you looking at me like this. It can also be on the phone as well. One of the things is that we will help the individual no matter what your fear is. We're going to make ourselves available to you one way or another. But we still have to understand that due to what's going on and right now, we do have to still continue to keep you safe and keep those individuals, to keep everyone safe. So we still have to practice, like Carlos says, that social distancing, but there's no reason why we would not be able to still help, if that makes any sense.
Yeah, it absolutely does. I mean, I think that, you know, I love Carlos's phrasing, you know, where there's a will, there's a way. And I know that, you know, you all are a couple of the providers in the community, but there are so many more who are still seeing individuals face to face, right? They're, you know, wearing their face masks, they're, you know, disinfecting. And so they're still kind of offering that in the community.
I know, I'm sorry to interrupt you. I know Aliviane is for sure. And I know that Trinity is for sure. I know, of course, our Paso Behavioral Health is. So yeah, there's still a lot of services where if we can't do it for you, we'll find somebody that can, but for the most part, we all can still provide that service for you.
And so So thank you, Nicole, for that question. Really appreciate that question on virtual services and folks who aren't comfortable with it. We have another question, and I'm going to jump to Liz in terms of this question first, and then we'll kind of see if other folks have any additional comments. Adolescents, right now that they're no longer in school, how can they receive services?
They still can receive the services same as anybody else. We actually do still see individual adolescents via telehealth services. So they can come through our office, through OZAR. They can be referred to us. We can do that screening and assessment, and we can refer them out to our CHAMPS program that we have for our adolescents, which they're still providing those services for them via telehealth. And also the community itself. I know Aligana has adolescent services. I know other programs also have adolescent services. So it doesn't change just because they're adolescents. We're still providing those services. Absolutely.
Wonderful. Thanks, Liz. Carlos, anything to add to that?
Yes. We're still seeing children and adolescents. So we start our services at ages 5 all the way on up, inpatient and outpatient. So when somebody comes in for a free assessment, it kind of depends whether they're going to go into inpatient or outpatient. If it's outpatient, we'll go pick them up. We provide transportation. We provide, meals, of course, and of access to their doctor 4 groups a day. So they can still get all the services that they need inpatient as well. So it's all a matter, again, of just reaching out, and coming in for that assessment. We're still seeing adolescents that are at home and get bored and start abusing substances or having, mental health issues. So we're still there. It's still business as usual as far as that.
Yeah, Annette, any thoughts on kind of this adolescent services question?
So 2 things. One, even those kids aren't physically on campuses right now, it's my understanding that schools are still doing some counselors are still doing outreach with individuals that they've had previous contact with. So that's an opportunity for students and parents to still reach out to their schools, to the district, to see what's available, if they need referrals or if they're comfortable talking to those individuals first. And then, of course, kids are still glued to their phones. So if there are youth who want to know about how to quit vaping, how to quit juuling, how to step away from that nicotine, then the Truth Initiative still has their program up and running. Kids can text, ditch, juul, and they'll be able to find services, a person to text and to talk to about all of that. And I will send that information so it can be posted in the chat. But DITCHJUUL, if you text that to, and I'll get the number, I apologize for not having that available, but that is an opportunity for youth who are interested in learning more about quitting juuling.
Yeah, fascinating resource from the Truth Initiative, and we'll also include that in that Facebook feed. That service, that texting service, if you want to quit e-cigarettes. We have another comment from Julie, who's kind of highlighting how we have to do harm reduction strategies. Similar to the way that we did with HIV epidemic and that early increasing number of cases, back in the 80s. We're kind of having to adjust this now in this COVID-19 situation where we're seeing an increased number of cases and practicing those harm reduction type strategies that can minimize getting infected, like social distancing, face mask, and other things that healthcare providers have been kind of promoting through their different platforms. I do want to, as we're waiting for some more questions, we're 10 minutes away to kind of wrapping up our session. So thank you all, first and foremost, for those who've been submitting comments or submitting questions. Hopefully this has been helpful to you. I do want to also jump into my next question for our speakers. One of the things that Annette was highlighting early in the call is how folks are not accessing tobacco products at school because they're no longer there. But how has the tobacco situation changed? What would you add to what you've previously said, Annette?
I think because of what was stated early on about being more susceptible, being more vulnerable to the coronavirus, I would predict that you probably saw individuals, and again, anecdotally, we've seen national organizations talking about getting questions. What is it going to do to me? So people are curious. They're a little more aware of their own health and the negative effects that the use of tobacco and nicotine can have on their body. So they're just asking more questions. And the best part about that is when they ask more questions and they're more ready to hear the answer. So hopefully that means they're ready to take steps sooner than they would previously.
Yep, absolutely. And I love that kind of mentality that as people are asking questions, they're more receptive to getting responses, getting resources. Liz, I know that you all at Emergence have recovery coaches working with you all. Have you all seen any changes in terms of recovery services during COVID-19?
I think we have, Ozark does have one recovery coach at this time. And so some of the things that we've seen is just really no changes in how it's the services that are being provided. The only change that we're seeing is, of course, that it's now telehealth services. So it's not being able to go out to meet that clients in their space or out in the community or have them come to our offices. That's really the only difference right now, but the services are still being provided. Like Carlos says, it's business as usual. We're still providing those services to our clients in terms of recovery support. And of course, making sure that we're giving them, our counselors are able to give them additional resources for the continued recovery support, the services that are available online.
Thank you, Liz, for that. We also have another comment, fact from the CDC saying that 10.5 million youth are exposed to e-cig ads while they're online. Absolutely. I mean, I think that's something that folks who have been in prevention are aware that these marketers are trying to get to youth, because if they can get them young, they have lifelong customers, right? Annette, you know this. Tell us a little bit about this comment.
So, unfortunately, when you look back at the Tobacco Master Settlement that prohibited cigarette manufacturers from advertising, along comes a new product that isn't covered by those same laws. So, and can backdoor their advertising, starting with the cable network, and then with the explosion of different social media platforms, the last 10, 12, 15 years, you've been able to see, yes, 10.5 million opportunities for these advertisers to reach out to youth and to get their replacement smokers and push these products. Laws don't keep up with technology. I think that's what we know and what we're seeing. So unfortunately, right now, those ads, we cannot affect those ads until policy legislation catches up with the internet. Hopefully within the next few years, as the FDA reviews these products, we know that they have, due to the final rule, been determined to be tobacco products, but they're still not included in those same policies. So hopefully, as makers and producers are required to submit their products for FDA approval, that will change and will be able to affect more of their sales practices. In the meantime, we can still work with different government agencies, different local groups to see what we can do to affect that change a little bit more quickly.
Thank you so much, Annette, for that comments on kind of how tech doesn't is working a bit too fast for our regulatory system. I think that's an accurate, definitely an accurate statement to say. I want to spend our last 5 minutes in kind of being as helpful as I think that we can be in providing resources that would specifically help those that are listening. Maybe they're not on the call right now live. Maybe they're going to be watching this a little bit later. But I'm going to kind of go one by one. I will go Annette, Liz, and then Carlos. But I want to, folks, what resources would you say, hey, if you need more additional information, check out this page, or what if you need help with this, that maybe resources that we haven't mentioned, that way folks can get those resources. I know one that I think is so crucial, SAMHSA, the Substance Abuse Mental Health Services Administration. They not only fund grants, but they also have a resource finder. And so we'll enter that resource finder that way if you need help as it relates to substance use, we'll put that in the Facebook feed, that link. Annette, what other resources would you share with our audience today?
I think if you're looking for questions on tobacco use in the lungs, I think the American Lung Association has a great FAQ where you can look at more information. If you're looking to quit, again, 915-534-7848 is the best number to call. It's quick, it's easy, and you get information right away. And last, I think there are, for parents who are looking for more information, there's a group out of New York, Parents Against Vaping, PAVE, who have excellent resources for parents who want more information. So I think they're another great group to reach out to.
Thank you, Annette, for those resources. Liz, what additional websites or phone numbers would you provide to our audience?
It would help if I unmuted myself, right? So one of the other ones that is a really good resource for both adults and youth, adolescents to have, is the National Institute on Drug Abuse. So NIDA, NIDA, the National Institute on Drug Abuse. So there's a lot of information there on substance use, on frequently asked questions. There's also a NIDA for teens, where they provide the information in a lot in their language. We also have the National Institute of Mental Health as well. That's another one. Those are two that really have a lot of really, really good information on top of what you said, which was SAMHSA. And then, of course, a shameless plug, of course, Ozar. Because, I mean, we really are what I consider the front door to be able to get those services, because it is also our job to have a resource directory available to the community that's actually posted on our Emergence Health Network website. If you go through our Ozar link, you'll have a resource directory that has everybody who's here plus everybody else in the community's information. So you'll be able to get an updated resource list that will be getting updated actually the end of this month as well, with some new contacts, some new resources available for everybody. So definitely Emergence Health Network, just go in there and look for our resource guide. And there's a lot of information in there about the community and about other sources like the ones that I just mentioned.
Thank you so much, Liz, and definitely not a shameless plug. I think it's so helpful that people have the Emergence Health Network information. And so what we'll do is in the feed, we'll also include Annette's. I know that Annette has a website in terms of smoke-free and the network. So we'll put a link in that news feed for you all, Emergence Health Network. Last but certainly not least, Carlos, what additional resources and phone numbers would you provide our audience?
Well, if somebody finds themselves in a substance abuse crisis or a mental health crisis, I would definitely tell them to reach out to our admissions line at 544-4000, at 915-544-4000, and get them to, like I said earlier, a safer place than where they're at right now. We have our website at elpasobh.com that has important resources on there, as well as our Facebook page. Everybody's on Facebook, look in, and that'll have some links to other organizations. It's not necessarily us, but something either nationwide or in a community level that they can access through there. But it also has information on how to schedule your free assessment, how to schedule a telehealth assessment or a walk-in situation. So I definitely use those numbers and those websites to try and get them the help that they need.
Thank you so much, Carlos. And we'll definitely include that number and website for El Paso Behavioral Health. Make sure that folks have that information in terms of how to access services. As we've reached the hour, I do want to thank so much my speakers today. So much helpful information, resources, and insight. Annette, Liz, and Carlos from the YMCA Emergency Health Network and El Paso Behavioral Health. Thank you guys so much for kind of joining this conversation, for having this and being available. I'm so grateful for this. And my hope is that our audience on Facebook, that they benefited from the resources and the information that was shared today. If you like these types of events, please feel free to direct messages, comment, let us know, hey, have another one on this other topic. We'd be glad to do that. And we're like we were talking about early in the call, we're not the only ones who have our own kind of Facebook Live events. I know that Annette was on Facebook Live not too long ago with the foundation talking about smoking. Emergency Health Network and OSAR program has their Facebook Live events. And so please reach out to these folks, super helpful. I'm really grateful to have you all on the call. And with that, I'm going to kind of close us out, right, for this conversation. Thank you guys. We appreciate you guys so much. Take care.
Take care.